I'm Marcelo Hochman. I'm a facial plastic and reconstructive surgeon. During my residency training, we did a lot of surgery for cancer patients. And so early on, I started being attracted to trying to restore appearance and trying to make people functional. And that over time is translated into cosmetic surgery and reconstructive surgery in children, which is what my practice is made up of now. From my point of view, the patients all want to look as good as they can, whether they choose to electively or whether they have to because of birth problems or inherent problems in the development of some of these vessels. Malformations manifest themselves as either as lumps, masses, stains, colors, and they have different natural histories. Some grow, some don't. They all get worse to some degree. Being able to take a child that has a facial difference and doing something very concrete that I know will impact the way that they face the world and interact with other people is extraordinarily gratifying. And to be able to do that at a time where they don't even realize is even better, because much of the things that we do, we try to get the best possible result by the time the child develops a sense of self-image so that they then move on, basically with a story that they're told by their parents as opposed to something that they're having to experience. When somebody has a facial difference, it affects the way that person interacts with other people. And once you correct that or improve that, that person's functioning in life actually improves. So vanity is a superficial way to look at it, but in fact it goes much deeper than that, and it's a very real thing that I feel really very good about helping people to overcome. So there are definitely moments where you see the difference between before and after, not just in terms of photographs, but in terms of how people respond. So on the elective cosmetic side of things, we see this all the time. People who are having to work longer or want to work longer, and they feel better about themselves now in the workforce and are able to present themselves basically as young as they feel. And then there are also teens who never had an opportunity to have their malformation or their tumor addressed, and they verbalize, how they're picked on less, or they are able to, go to social things without being a point of focus. I'm old school in the sense that the doctor-patient relationship to me is really the most important thing. And that's one of the things I enjoy the most, is actually developing a relationship directly with the patient. One of the aspects of what I do that I truly enjoy is pro bono or charitable medical care. And I think that's always been something, even as a child, that my parents instilled in us, is be able to give back or do something. We all have either a skill or ability or desire to help somebody else. It is something that I and my practice are dedicated to doing, is making sure that in terms of what I do within the realms of possibility, that we provide care for anybody who needs it.